Okay, great. Abdul, do you have anything you need to update us, Rose here, and Elliot, and Amina, and me?
Yes, like I've shared with you like my meeting with Wycliffe yesterday. I shared the summary report I sent to you guys about our meeting yesterday. And also today I met with the CHWs. I share with them like the updates on what is going to happen on two agendas. One, for the upcoming data collection training. And the second one is about like the upcoming medical camp, which will be at our field. So they are aware, but for the medical camp information, I told them, I just gave them like the brief information, but I told them that we'll be meeting, if possible, on a weekly basis before the D-Day. And I will be giving them like the assignment which they're supposed to do on that day. For like yesterday, I just told them they're supposed just to go and figure out how many families are there in their neighborhood who are suffering with the kind of the screening we're going to do, we're going to facilitate, so that they can just have the names of those families at their fingertips. When I will give them assignment to go and do the mobilization, at least they will know exactly which family are they going to give the information. For today, I just share with them what we discussed with Wycliffe about the training. And I told them that I will give them the update by tomorrow. I'm supposed just to write a summary report so that I can send it to you guys on what we have discussed and what is supposed to be done. When it comes to like the budget for the training also, I'm just, after the Zoom session, I'll just work on something, then I'll share with you like a draft, so that at least can give us like a guideline on what we are supposed to capture on that day. Fabulous. But all in all, the team are so motivated and they are ready for the task. We have lost some members of the CHWs. Some got opportunities, some went to Saudi Arabia, and some got married, and some are pregnant. So I'll just share with you like I'll share with you like the names of those who are active currently working with me, and with different situation which has happened from the rest of the members who are not active. But according to the meeting today, we decided as a team that we'll work with the few individuals who are there. There are around like 16 active. Those are the members we'll be working with. And if you guys will give me like opportunity to recruit another like 10, so that we can have like at least 20 or 25 members, I told them I will give them opportunity to go and recruit individuals who are active as they are, in case of anything which will happen, because I don't want to take the responsibility of going to recruit. I will give them that opportunity so that they can select or recruit somebody who have the same motivation, the same psyche as them. If they don't get such character, they should just leave it for me. I can do it. So I told them I'll get back to them. We have like a WhatsApp group page whereby at least I normally communicate with them in case of any information, so that at least they can capture what is happening at Wayo Health Program. And after me sending like the message to WhatsApp, I normally accompany it with a text, whereby I just share with them like with a text on what is happening. So in most occasions, we are on the same page in terms of communication. So those are some of the things at the moment they are at my hand. And also, Wycliffe gave me like a go ahead just to write like a official letter to the guys in charge of the field. So what I will do, I will just draft like I'll write a draft letter, then I will send it to you, so that at least you can do like some editing before I send the final draft to the guys, to the right authority, so that they can also book for that day.
Excellent.
All in all, I think
those
are some of the things I've done so far. And I will be meeting with the community coaches also tomorrow at 10. I've been calling them, all of them. So I got like a response from 25 coaches who say they will turn up for tomorrow. So what I will share, I'm going to share with them on the issue of also the training and their role as a guide, so that we can get all the information, and also some of the incentives we'll give them as individual, as a coach, and also incentive which will give them for the team, so that also both parties can benefit from what we are looking for or what we are working for.
Oh,
Those are
excellent.
some of my updates.
Did you see Wycliffe join this?
Yes. Okay, Wycliffe, I think he was listening, hopefully, so he got an update too. Wycliffe, you're on mute. Who has that baby screaming in the background? Abdul, is that a baby in your background?
They are so far from where I am. Let me just communicate. Just a minute.
Okay.
Yeah.
Must be Abdul. It's not me. I'm the only one that's not on mute. Oh, good. Okay. Wycliffe, welcome. Now you're on mute. Wycliffe? Oh, Christian's here too. Let me get him in.
Wycliffe is muted.
He's on mute.
Mhm.
Asked to unmute. Okay, I'm going to ask him.
Hello, this is Christian.
Good
Hello.
morning, Christian. How are you?
Fine, thank you. Good morning, everyone.
Oh, okay,
Good
Wycliffe.
morning.
Okay, good. Good morning, Wycliffe and Christian.
Good evening.
Or I mean, good evening
Good morning.
and good morning. So, Wycliffe, I don't know if you heard some of Abdul's update. Wycliffe?
You just sent a note that said, I cannot unmute.
Oh. It's unmuted, Wycliffe.
Oh, no, I'm okay now. I've been struggling.
Oh, I'm sorry. I didn't mute you. But anyway, where are you on here? There you are. Good morning or good evening.
It's a good evening.
Yes.
Yeah, so sorry about that. I was struggling. I didn't know that it would be difficult to unmute.
At least you're here and we hear you now. This is great. Did you hear Abdul's update?
Yes, I did hear part of his update. We met with Abdul and we agreed on most of the things. I think one of the things I would just recommend probably with regards to the letter.
Yes.
The letter, yeah, just should be a simple letter requesting for use of that ground on 11th June. And they should probably just have the Wayo logo. They should not know that there are any other people, because the expectation in this community is too high. So when you bring a lot of logos coming in from different organizations, they might really be expectant. So probably I'll be able to share. I know Aminata had asked me about the logo, but the week has not really been good for me because we've been doing some trainings. Even actually Abdullah had to come to where I was so that we were able to meet. So I will be able to share. So we'll use our NMS logo and a Wayo, so that the expectation, we lower the expectation of the people who are in charge of the field. Yeah, so that is the only bit that probably escaped my mind, but I can confirm that all that was shared via the minutes that he had captured and what he has been able to share orally is the true position, and we will continue to support it that way.
Great. Thank you. So let me just confirm. So are we all set to use the flyer then with Amina's edit?
Yeah, sorry, I mentioned that Amina had asked me to share a logo, which I'm yet to share. So I'll probably share this logo now. Probably I can share now with her.
Perfect.
So that I don't have to forget. So I'm going to share that with her right away. and then we'll be able to use that logo. Like I mentioned, there's someone in charge of development of information, education, and communication materials, such as flyers. And I think once that has been inputted, I'll be able to share for her to give us the go ahead.
Okay, good, because we have to start sending.
Then the other update I've had is that the other update probably I could just share up front is that you remember I'd mentioned that we are going to, I was looking for certain partners to be able to support us with the, I don't know whether you can be able to hear me.
Yes,
or is there
we can
noise
hear
in-
you.
on
We
my
can hear you
background?
fine.
Yes, so there's something, the Ministry of Health normally plans for what we call a week to look into the milestones related to nutrition. So it's a nutrition week or a nutrition month. We call it in Swahili Malezi Bora, good nutrition. So here in Kenya, we do celebrate this in May and in November. So the partners we work with are committed to support this particular program that is starting after next week, I think the following week. Yeah, so they had requested me that probably we need to push this so that they're able to get other resources to support. But I had told them that it would not be very easy for us to postpone this. So I felt it is good for you to understand that the other people we wanted to collaborate with are already going to support this particular program. We are talking about the good nutrition or the Malezi Bora week we are talking about, and they have immense support. They are going to support about 500 community health workers or community health volunteers for that matter to visit households and give services, that is deworming, vitamin A supplementation, plus information, general information to the household. So it's a huge thing that is coming up, and it's going to hinder the support that they might give to us come June. So because it is not feasible to basically postpone this, given the fact that there are people who are already planning to come, and over here the traveling days have been set, so I told them it's not going to be possible, but I felt it's good for us to be able to give you this information because for me, I think we'll still need to proceed as planned.
So when is there, is it going to be in Kibra?
Is
Is it going to be, is there good nutrition fair going to be in Kibra?
it is actually starting on mid next week, which is probably on 26th.
Oh, okay.
For the next 7 days. For the next 7 days.
In Kibra.
It's actually not in Kibera. It's throughout the country. This is something that is happening throughout the country.
Okay, so we're not until the 11th, so that should be okay, don't you think?
Yeah, it is okay. What I'm saying is that probably they've been able to commit their resources towards supporting the Ministry of Health in regards to the Malezi Bora week.
I see. Yeah.
Yeah.
Well, that might be a problem then. Do you think it's going to be a problem, Wycliffe?
Not necessarily a problem, a big problem for us. It is
Okay. Okay. Well, let's go forward then, because it's still, it's not like a week before. And like you said, we have our plans and everybody's ramping up. So, thanks for that information. Now, I sent out to everybody the list on service providers and sponsors and other government services. Wycliffe, are you going to be able to send us something like that?
Yes, I am.
Oh, good, because it'd be good to know who's coming, who the contact, so we can stay in touch with it and also thank them. And then for sponsors, Abdul and I are going to be calling these people next week, once we have the flyer, to see if they would be interested in making a donation, because this would be a good marketing opportunity for them, the for-profit companies. I know it's not a normal thing that's done in Kenya, but I thought we'd start it with some more enlightened companies. Some of the newer funded companies like M-Pharma, international companies like UPS, where they're used to sponsoring other countries. So we'll let you know how that goes. And Abdul and I will be contacting those companies. There'll be insurance companies, health-related companies, and then just general companies like UPS, large international companies, because that would help us then get funding for the next fair or the next big project we do in Kibra. So anyway, so if you could return those, just who's going to be there, because we can talk to the sponsors as well. And you had said we could expect maybe about 500 people to 1,000 people. I need to mention that to sponsors. Would it be fair to say we're expecting between 500 and 1,000 participants to show up on the 11th? Wycliffe, you're on mute.
Yeah. Yes, we are basically expecting to, at least with good mobilization, to get at least 500 participants.
Okay, good.
Or beneficiaries for the service.
Fabulous, fabulous. And then, Abdul is staying in touch with me with the budget, and which will be great. And I will be sending the funds to him as they're needed, ahead of time of when they're needed. So if you can work with him on that, and so he's been, your meetings with him have been very, very helpful, because then he communicates to us everything that's going on. So we know we have to be prepared. Now, do you have any questions for us or needs from us?
Personally, I think I don't have any questions, because we've been in touch with Abdul. If he has questions, he normally call. If I have any question, I call him, and we've been able to meet quite frequently. Actually, we just met earlier yesterday. We met yesterday. Yeah, so I think I don't have any question for now. If I would have any questions, I would directly channel them to Abdul. Yeah, so that he's able to respond to it.
Now, I know I have a question for you, Wycliffe. Is it normal to invite special people to the fair to make an announcement or be introduced, somebody from the Ministry of Health, or some, mayor or some government figure to come, or just some VIPs?
This is quite in order. This is very much in order. This is very much in order. Actually, I had mentioned to, and my son wants to wave at you.
Hi, what's your name?
My name is Steve.
Steve?
Otieno.
Yes, Ray Steve Otieno.
Oh, hi, I'm Nancy. And there's Bill, you can see. And we have Elliot and Abdul and Christian. So I'll meet you when I'm there. And there's Amina. She's doing the flyer for us. So
Hello.
yeah, well, you can stay with us and learn something what we're doing. So
okay, so now I was saying earlier
yes,
that we would also plan to invite the senior management, so we can see whether we'll be able to either meet the director of health at his office, or whether I can be able to join in during this particular day. So I'll basically look into his schedule, and then I can be able to communicate that. So that is something we are looking at, and we can also invite both local and local leaders. We can have those in charge of security issues, those in charge of because health is basically a multi-sectoral approach that is really required. So we this is something that is very much okay. So ours is just to identify key people. Me and Abdul, we can identify key people that we think that would be relevant, and then we just have a standard letter sent out to them.
Perfect. That'd be great. And just, yeah, then Abdul can communicate with us, or you could just communicate with us too on who those people will be. That would be terrific. I have a few people to invite that I'll send to you, Wycliffe. One is from the Ministry of Health, Omar, and I can't remember his last name, or maybe that's his last name. He's a close friend of mine over here. He met him years and years ago, and they've stayed in touch, and he introduced him to me. And I'm going to ask him if he would come to the fair. I don't know how high up in the Ministry of Health he is in Nairobi, but I'll let you know, because I thought it'd be great for him to meet you, and if Dr. Asma is there to show
Nancy,
you.
I lost you. I lost you, Nancy.
I'm back. Do you hear me now? Wycliffe, can you hear me now? Oh, I hate that when we lose people. Abdul, can you hear me? Can you unmute yourself?
Yeah.
Okay,
Yeah,
then.
I'm getting you much
Perfect.
clear.
Okay.
Yeah.
Abdul, I have a question for you about how many kids and their families are going to be playing soccer that day.
Abdul, you're on mute.
On that day, we have planned to have like matches starting as early as 9 until 4. So on that day, apart from the teams which will be playing on that day, we also be mobilizing the parents of the players who are playing at our league. So what I will do as tomorrow, when I will be meeting with the community coaches, I will share with them that I will give them like the flyers when they are ready, and also the letter of invitation, so that all the kids who are participating in Wayo league, so that they can go and invite their family and their relatives to come for that occasion. And if it will be possible, we'll be having like a registration. I don't know if that will be possible with Wycliffe, or that's how it's being done, so that we can know exactly which teams have mobilized their parents to come for that for that fair. And
Abdul?
that also I will discuss with the community coaches by tomorrow.
Good.
Abdul?
Yeah, I'm getting you. Yeah.
Oh, have you invited the UPS area manager?
I haven't invited the UPS because I was waiting for the final flyer, so that at least I can get like also an official go ahead from you guys from the other side, so that if you guys send the letter, that's what my suggestion from the last time. If you guys send the letter, what I will be doing, I'll just be doing like the follow-up to make sure that at least we get the information. They got the information, or some of the materials maybe we'll be needing from them. So that's what I was just waiting for.
Yeah, and Abdul, just to remind you, you and I are going to be calling the UPS person, Jesse.
That will be fine.
Yeah. We're going to make the calls, Bill, of the people that we know personally. The Bitram person, we're going to call him. Was it a him? I think it was a him at Bitram Insurance. Abdul, we'll call him. Can you write down any of the people that are from the bigger companies like UPS and Bitram and M-Pharma, people that you have the names and contacts of that we can call? Is there anybody besides those companies?
I think those are some of the companies at least we are already approaches.
Yeah, I can't think of, if you can think of any other ones, let me know, because it'd be better if you and I call them and just send a letter. We'll have a Zoom call with them. because, you
Okay, I
know,
will.
we'll have a better chance. There's not a lot we will call, but we want to call those important ones first to see if we
Okay.
can get a sponsorship. But you're
For
right.
sure.
Yeah, we need that flyer. So stay on Wycliffe to get the logo to Amina, because it's holding us up right now. And we really need to call these people next week. And I'm gonna, you know,
Okay.
yeah, and I'll send out the Zoom invite to, I know. Do you have Jesse's information? You can just WhatsApp me or send it to me, because then
Yeah, yeah. The last time I met with him at his office, he gave me his card, business card.
okay, send me his
I will just send you like everything about.
Yeah, perfect.
I'll just scan and send it to you.
And send me the Bitrum person too, okay? The top person that you met there.
Okay, I will.
Yeah, the person who was the area manager, I think it was, that you met.
Yeah, it was like he was like a junior staff who was dealing with the community issue, I think so. So I will just send you like the contact of that individual too.
Okay, good. Yeah,
Yeah.
that'd be great.
I have two things for you, Amina. Number one,
Uh-huh.
you know, where Wycliffe seems to be responding to very quickly. So you may want to also go to him and just get that logo thing, you know, finalized if you can, as early as whenever, today, tomorrow. The question that I have for you is, are you starting to reach out to all of those hospitals? And do you know if Simi is doing the same to see if they want to be, quote, participants in the health fair?
Yeah, so I reached out to a few of them that were on the list that Nancy provided to us from that survey that was sent out in January, but I haven't heard back from any of them yet. I also know that Simi has contacted some of those hospitals and clinics as well, but I don't know if she's heard back. I can follow up with her to see.
Yeah,
she,
if you would do that, that would be helpful. And then
okay.
related to that, if we can get any of them to be interested, they may want to, you know, provide something that could either be given away or raffled off or something like that at the event. And that leads me to ask
Yes.
you, Christian, if Abdul's going to have at least, it sounds like, more than 200 or 300 of his players who are going to be there, that maybe when you're there to start signing them all up on that that program. And that's all set, isn't it, Amina, that we now have the thing that can either be a paper version or can be done online?
Yep. Yeah, we have that organized already. So I can send that over to him again. So he has that on hand.
Yeah, I don't know if you're still on now, Christian, but maybe bring over, you know, whatever, 200 or 300 pieces of paper so that you, maybe with community health workers, can actually sign up people, and then we can get them put into the database afterwards.
Now, Bill
Okay.
has some new balls that are coming over with Christian in the duffel bag. We could use those as raffle items.
Yeah, and Abdul said he wanted to use some of them to give encouragement to his coaches, but we can certainly do that. And one of the things I want to check is going back to the leveling guys and see, I talked to their guy, Daniel, and he said he has some balls, but you need to put, you need to kind of stomp on them with the whatever that normally blows the balls up. If they're all blown up, you can put you can stand on them and get them to go down.
Oh,
to like,
no, there's a pin that I've been
That's
doing
what
that
they
for
are.
like 100 balls in the last year. The last group I sent over, they were all secondhand balls from a coach here. There must have been 100 of them. I washed them, and then because they were a little muddy and stuff, And then there's a pin you can get that releases the air.
Yeah,
and-
that's what.
And you
what it is.
gently step on them. It takes a few minutes, but not long, but you have to take the air out because then you can fill the duffel bag with lots of deflated balls. So don't stomp on them without that pin because it'll take you forever.
Yeah,
I'm
no,
an
that's
experienced,
what I think Daniel knows how to do that. So
yeah,
maybe
I'm sure he does.
I'm gonna try to get you, Christian, if you're still on, to get one whole duffel bag full of balls.
Yes. And if they're new, we should definitely use those for some of the raffle. Yeah, I just don't know. Well, we're going to ask for raffle items from the sponsors as well. And hopefully, I don't know if the hospitals are going to be and the people are going to be there, participating as service providers, have anything to give away. I mean, that's not normally done there. And so what happens is, they just don't have the funds to buy giveaways. We'll have to come up with.
I think if it will be possible, if you confirm from Wycliffe, because his experience on that field, how like the medical camp is being done, so that at least we can know exactly what to expect or what we are supposed to do. Maybe we can introduce something which will not work. So maybe Wycliffe, if we can share, because he have done several of medical camps, he can give us like a go ahead. And also, as I said before, the issue of like the balls, because when I'll be meeting with the community coaches, I'll be promising them that apart from them maybe getting stipend when they will be working as a guard with the community health workers, data collectors, that their team will benefit by us giving them a balls when all the data or the information is correctly collected in that in our data program, so that it can motivate like the team, and also as a coach, he can be motivated by being given like a small token of appreciation. That will be like the small stipend. So that's how we can motivate more coaches or more teams to come and participate in this program, because in the community we have like a big gap, or we have like a big challenge for the coaches to maintain their teams if they don't have like, especially like the soccer balls. For them it's too expensive, and at times getting like a free soccer balls is not easy. And also with the kind of the condition of the soccer field we are having, in most occasions, balls normally worn out very fast. So if you give like a team a soccer ball, they can do whatever you request them to do. So let's use like the soccer ball as a motivating factor to attract like so many soccer clubs or soccer teams in the community.
Now, Abdul, that's a great idea. What size balls are the average? Do you need a range of sizes? I know they come in size.
It's only three. There's 3, 4, and 5.
Yeah, do you want
3, 4, and 5 is okay.
any
Because
of
we
the?
have like all those categories.
Okay, but you want some of each, 3, 4s, and 5s.
Yeah,
And,
those are some of the sizes at least usable in our community too.
and how many balls are you talking about that would be important to have?
So by tomorrow, I will know like how many teams, how many coaches will turn up for the meeting, and also I will count how many teams have registered. So I'll just do the calculation, then I will send to you guys prior, so that at least you can know exactly how many balls will be giving out for the community soccer teams.
Okay, well, that's terrific, because Bill will have time to get more balls and less other stuff. If we need more balls, that's great.
Sure.
That's great
Elliot,
information.
Elliot and I were talking about going back.
Yep. Jennifer's on the call too. Jennifer,
Hi, Jennifer.
When you reach out to those 4 soccer clubs that you and I talked about, ask them, among other things, not just for gear and to get old phones and stuff like that, but see if they have soccer balls that they might want to donate. And we will arrange with the leveling playing field guys to get the balls either picked up or brought over to their warehouse, I could see potentially us getting 100 soccer balls, maybe even more.
Wow. That's terrific.
Okay,
And
I'll
that's-
contact
that's a
them
good
and
news.
see.
Because you know, I know on my flight, you get two free bags. And I'm gonna bring over the used soccer balls I have still in my garage and only one suitcase. So with Christian, if he comes over, he'll have, it'll be a couple free bags. That's the best thing we could do with bringing balls over is through Christian in particular, because
Are
I
you
don't have
on-
new ones.
Yeah, are you on the call now, Christian?
I'm recording this, so
Yeah.
I'll make sure.
When I
Yes,
get
yes, I
back,
am. Yes, I am.
yeah, what I'm
Yes,
gonna
I
do,
am.
can I talk to you sometime separately, like next, whenever Monday, Tuesday, or Wednesday, Thursday would be better. But I have the idea that you can connect with Bill and get the duffel bag he has, and then arrange to go over to that warehouse in Silver Spring, working with this guy, Daniel, and see if we can get at least one duffel bag full of soccer balls. And I'll talk to him and you together to see what we can do to have you show up bringing over 3 duffel bags, if that makes sense. I think it does, right?
Yeah, that'd be terrific.
Okay, sounds good to me.
Yeah, that sounds great. And then what happens is, yeah, that'd be great. And if we can get all those deflated balls, that would be really helpful for Abdul to get his coaches really excited about this. And then the ones we have left over, we can use as raffle prizes. Because that sounds like what everybody really wants, right, Abdul?
For sure.
What else would be a good raffle gift? Do you think?
I think like the bigger problem is soccer balls, because like other stuff, maybe some coaches can manage to get. So if you can have like soccer balls, and also we have like this thing called like field markers. If you have also field markers to act like a raffle, also that also.
What are they called?
Field markers. Field markers.
Field markers.
Yeah.
Are those little discs?
There's little cones and then there's flags.
Cones for marking the field.
Okay, so if you can
Yeah.
find more of those, Bill, add those. Anything else? Well, I guess we also, for just the general public, what else would we want to add for raffles that are not necessarily soccer, but
Yeah,
could be?
I had that question. I don't know, has anybody, whenever they have soccer tournaments around here, they come up with a booklet, a little, whatever, 10, 15 page one where people advertise. And
We're not
the
going to be
adver-
able to do that, Elliot. It's
Too
not
much.
going to happen.
Okay, but
It-
what we could do in raffling off things, maybe the insurance companies, including NHIF, would give somebody, an annual $60 insure them for a year. And
Fabulous.
that could be,
Fabulous.
maybe 10 or 20 people getting an annual insurance one. I think people would get excited about that.
Now that's great. That's fabulous. Because that doesn't cost them really anything. That would be great. That's a brilliant idea. Keep going. Anything else?
Go back to Amina and all on that kind of thing. One of the things that we may want to ask when you're trying to reach any of them would be to say, are you willing to help underwrite somebody to make sure they get the NHIF insurance for a year?
Okay.
I would think some hospitals might very well be, even if they say, oh, I'm not going to give $60, maybe they do $30 for 6 months.
Mhm.
Yeah. Yeah. Yeah.
That's a good
And-
idea.
And Abdul, any other ideas? Keep us posted, something that people would want from some of our sponsors.
I will.
Yeah, because you know best what would be helpful to people there. And would be easy to ask M Pharma or the health insurance companies, UPS. I'm not sure what UPS could give, but yeah. So now we'll start working on this. So we have a couple of weeks. That's terrific. Abdul, anything else that you have on your mind for this?
I think if something will pop up in my mind, I will just communicate officially to you.
Okay, good. And Christian, how are you doing? Do you have anything you need from us or from Wycliffe?
Yeah, I'm doing fine. For Wycliffe, I'm still waiting. I want to know exactly how many providers are coming and what they will be doing so that we can start setting up the boat to know exactly how many we're going to have and know exactly which provider will be assigned to different boats. That's something I'm waiting. I'll be waiting for him for that one. For
I
that
know,
2 weeks.
no, that's an excellent question. We are too. And Wycliffe earlier, before you got on, said he was going to send that, but I think I'll remind him, okay? Because
He's on. He's on the call.
I know, but I don't, Wycliffe, are you still there? He muted himself, but he might have left.
No, I won't leave. I'm still very much here.
Oh, good.
I've just been following up.
That's okay. No, you're double tasking. Good. So, you know, Chris, did you hear what Christian asked for?
Hello,
Hello?
can you hear me?
Yes. Christian, why don't you describe what you're looking for again to Wycliffe?
Yeah, Mr. Walker, I want to know exactly how many providers are coming, what they will be offering, so that
How
we
many?
know
many
provider,
booths?
healthcare provider, so that we know
Healthcare
exactly how many
providers.
we're gonna have and we know where to assign those providers. In that list
So
has to be done before the hosting.
I think I'm really struggling to get him. The first question, part of the question I've had. The second part of the question I've not had. Sorry if probably someone could expound more. In terms of if I can just go ahead and answer the first part of the question is that can you hear me, Nancy? Are you struggling to hear me?
We hear you loud and clear. You're coming through.
Okay, so I'm saying the first part of the question that I had, how many healthcare workers are coming? I think, remember we had this meeting with Abdul and we had already suggested the number of people. So we said that this is going to be primarily dependent on the number that can be supported, because we have anticipated to have at least 20, it was I think 20 healthcare workers, and we also had anticipated to have 20 mobilizers. So this is some information that I've already shared, but as to the actual numbers will be dependent on how they can be able to be compensated for their lunches and their transport.
Oh, Wycliffe, excuse me, I'm sorry to interrupt, but Christian was asking about the healthcare providers, you know, the people who are
Yes.
going to be in the booths. How many of what do we have there? The booth providers.
Now, the booth providers, if I may get you clear, are people who are going to provide services.
Yes.
Services.
Yes.
Yes. So I said, and you know, we have different service delivery points. Like we'll be having a particular point that we are going to be doing growth and monitoring. We'll be having a different point where we'll be giving immunization for both COVID and also for the routine immunization. We'll be having a booth where we'll be screening for non-communicable diseases. We'll be having different booths. So what I'm saying is the numbers will be determined by the people that can be supported in terms of how they are going to, and of course we are anticipating to have about 500 people. So we have at least to expect 25 healthcare providers coming on this particular day. However, if we feel that the budget could accommodate more, we can have more people. If we feel that that is too much, we can bring down the numbers if we are not able to serve. So for me, I think the service delivery points are very much clear. I have talked to the person in charge of nursing services, and she has earlier this morning, she has assigned as someone who is going to be coordinating the various service delivery points in the name of Alice. So most probably the next meeting I can come along with Alice, because but we had set out that by next Friday, was it 26th? Or probably can say by Friday next week, we should be very much clear on every other thing. So my point is that we have the outreach coordinator, someone who's going to be coordinating different service delivery points from the laboratory to nursing services to any other referral pathways that we are going to expect. So the numbers would basically depend on the how the people that can be supported to give the service, because if they come, for sure we are going to expect to give them their transport and of course for lunch reimbursement. So for me, I think that is clear.
How many should we be looking at having? Is 25 a good number?
I had mentioned should be working at least 25 people. Yes, 25.
You think that's a good number? So, well, we'll do 25. Yeah, if you think that's an adequate number and it covers everything, let's do it.
Yes, so I had mentioned that we have a minimum of 25 people, and I also mentioned that I've been given someone to support this in the one. Alice Shundu is a very experienced nurse and a very senior nurse for that matter. So we are going to work with her closely. I also remember one of the tasks that I was given last time is to be able to come up with a layout of the setup for this particular day. So she's going to help me to come up with this, and the deadline was for presenting this was 25th, if I still remember very well.
Oh, fabulous. Okay.
Yes, and then I wanted to contribute. I think Abdul had mentioned about the football teams that are coming. So I don't know, and I think we didn't discuss this, but I hope we are not going to be having too much football on this particular day. Yeah, because I'm trying to imagine the services that we are going to be offering, and also in terms of the limited space, and also in terms of even the ground itself, it's kind of dusty and stuff like that. So I'm just hoping that we are not in as much as we are going to use football or sports as a means of passing information and reaching out to the youths to ensure their especially the issues of sexual reproductive health, issues of rising NCDs among the youth and stuff. I just hope that it's not going to be a whole out and out sports event. So probably if there are going to be even teams that are registering, my advice would probably be that we have maybe if it is going to be kind of a tournament, then we have some of these matches or these games played much earlier, so that on the fateful day we don't have so many games being played.
Okay, you coordinate that with Abdul, whatever you two agree that is the best thing for the day, go ahead. No, really, because like the soccer sounds like in the morning might be okay, because it won't be a lot of people at the fair yet. And then the afternoon, leave it more open. And we were going to even have some, bouncy things for the kids. Abdul was suggesting. So that would be, instead of the soccer in the afternoon, some areas where the kids can play while the parents.
And entertainment, yes.
Yes, while they can go over and look at the booths, the kids can be playing in the play area.
That is nice. That is nice. And actually, that would be nice, because we were training on nurturing care. It's a training basically for child development, and one of the key things we have set out is to ensure that the facilities have some space where kids can be able to play. So I think that is coming perfectly well. I also just wanted to mention, because I hadn't shared the logo with Amina Tayes, but she can confirm that I've already shared the logo. So I think that is an update I wanted to make.
Oh, good.
Yeah.
Oh, thank you. So Amina, you're all set.
Yeah, so I actually went ahead and put it on there and I sent it out to you all. So the
Oh
flyer-
God, you're so great. What a team. What a team. Thank you, Amina. So
Wycliffe,
yes,
I have a question for you. Are you going to be able to provide COVID jabs to people who are there? And how many would you be able to do?
Yes, we are going to do this. We had a side meeting with Nancy and Christian, and I think we agreed that we should have two, at most two different vaccine types. So at most two, yeah. So we are going to provide this, and like I've mentioned that I have been I've been assigned a coordinator for this particular affair, and this coordinator is going to help me come out with these other plans. But ideally, we should have these vaccines available for up to 2,000 people. So
Wow, that would be really
as
good.
many people as possible.
Yeah, if you could do something like 2,000, that would be a huge success, I would think.
I know. And we're gonna hopefully, have some videos going on and interviews for some, stories. Wycliffe had said last week when we had our discussion. So, we'll be able to share that with the press and with other, other people. So
Who
it sounds
can-
terrific.
Who can provide?
Yes,
the
that would be fine. Yeah, that would be fine. So the other thing that you probably need to start developing is consent, informed consent.
Oh, I'm sorry,
because
what?
if you're
Informed
coding and
consent.
yeah, so it's good to have to develop a consent for that.
A concept.
No, people
Informed
have to sign
consent.
something. It's a consent
Oh,
form.
consent, of
Yeah.
course.
Yeah, it's a consent form. So who can provide vaccinations? Can pharmacists provide them?
Here in Kenya, vaccinations are provided by trained nurses.
So he's gonna have nurses there, and he and Christian discussed that.
Okay.
So I think we're all set with that. And then, okay, now, did you say, are we gonna talk next Friday, Wycliffe?
Yeah, let's do that.
How is,
Definitely, because
Good.
we need to, we probably need to be having weekly meetings.
oh, absolutely, I agree. No, yeah.
So that we do not want to fail. We don't want to organize something that fails. So
Oh,
it would be
absolutely.
good for us
We're
to have
with you.
updates, probably
Yes.
weekly updates.
Okay, we'll have a lot of updates for next week. The sponsors, at least from,
Before we go, Nancy, before we go, I have something for Wycliffe. Before we go, Mr. Wycliffe, can we please have for next Friday a definitive list of the provider who will be at the health fair by boat? I want to know which provider will be assigned to which boat before the day of the health fair.
yes. Yes,
That's what I want
Okay.
us to do. We're gonna have such service at this boat. Let's say boat number one will be this healthcare provider. We know the name. For
Yes.
each boat, I want to know which will be assigned, which service we provide to each boat. That's what I want before the health fair.
I think
Is it possible to have a list like that for next Friday?
I can't promise that, because one, we can only confirm the number of healthcare workers that are going to be stationed at a particular booth, but I cannot confirm the specific healthcare worker that will be available on that particular day, because of the dynamics we have here in this part of the world. So maybe this is something that you can have a week to probably a week to the fair, but having this by Friday,
Okay.
things change pretty fast, and we could be changing the healthcare
Okay,
workers
at least for
immediately.
next Friday, can we have, at least for next Friday, can we have exactly the number of booths for the healthcare provider we know we can have, and at least assign the service that we provide at that booth, even though we don't have yet the healthcare provider for that booth. Let's say booth number one, we're gonna
That
have
is okay.
blood pressure checking. Let's say
That
booth
is
number
okay.
two, we can have diabetes checking. Is it possible to have that?
That is fine.
Good.
Thank you.
Now,
And that way, we can also, in the same trend, I haven't finished yet, please. We can also open a Google list or WhatsApp list with all those different booths and ask the provider who want to volunteer for those different booths so that we can know at least who is willing to do what. We can
yes,
have the booth set up, the different service set up, and then open an open list for the provider so they can volunteer for each booth.
So now, Christian, why this? And that is actually related to your earlier question. Why this is not going to be very easy is because the healthcare workers that we are talking about, they are not freelancer healthcare workers. They are providing services to the Ministry of Health, and they have duties, and they have been allocated duties. So whenever we have outreaches, we request different facilities to give us a particular healthcare worker, depending on whether we need a nurse, whether we need a doctor, whether we need a nutritionist and stuff like that. So now asking them to be in a WhatsApp group and to volunteer would be challenging, because now they'll definitely interfere with their programs or their schedules at the various facilities, and I think when you get to that level, the ministry will not be able to support what we are doing. So I think the best is let us have the booths ready. We know booth A is going to provide this service, booth B is going to provide this service, and the number of estimated number of healthcare workers for each service that is going to be offered. Then on the probably a week now into this fair, then we'll be able to have looked at the duties or the rotas for these healthcare workers and have them assigned. But even with that, I can assure you that pretty much do change over here, and sometimes not everything you plan 100% will remain so. So you'll probably have to adjust every other time, and I think with that, I would beg that I stop there.
okay, Wycliffe,
Okay.
thank you. That's great. I have a quick question. Is there anything that I could ask our local, physicians to give as samples or giveaways to your providers as gifts, medical gifts? I mean, in the old days, it would be masks, but everybody has masks now. But are there any things that would be easy to carry over that's not medical supplies, but something that you think that they would enjoy or need to have?
I think I may need to consult on that.
Okay, because
and then before I forget, do we expect to get some medical supplies in terms of drugs from you, this team, or where do we expect the drugs to come from the Ministry of Health? Or
I think so. We don't have any drugs to be able to bring, that would be impossible to travel with drugs.
Okay, thank you. So I will work with the coordinator, the outreach coordinator, and so that we ensure that at least we have some drugs.
Yes.
Yeah. And
Yes,
pharma may be an important one where they will have lots. I mean, they're a major supplier of different drugs that they may be willing to donate some of them for certain, diseases or whatever.
Well, let's
Do you have
see.
some examples on those?
Yeah, if you can send us, Wycliffe, or just mention some that you would be looking for, we can try. I don't know if M Pharma is going to provide those, Ellie, at this point.
Yeah.
maybe the next fair, but we can try. Wycliffe, if you could give us an idea of what drugs you're looking for. I mean, we would have to ask a company there, not, I couldn't bring him in.
No, that's a problem, but
Okay, that is noted.
Okay, good.
Christian, what do you think?
I think Nancy says all. We cannot bring any drug down there.
Yeah.
No,
Just can't.
it's too complicated for us to bring drugs in.
Too complicated. Or we can bring maybe something for blood pressure screening. That's what I can bring over.
Okay, good. Screening things. And, you know, and if Wycliffe, if you can let me know if there's anything that the providers would like or need that is not a drug.
Well, there's got to be, among other
Sure.
things, the hospitals would want to, many of them are going to want to promote a service that they have. So some of them, for example, might provide HPV for, you know, young boys and girls.
Yes, but we can't bring those.
No, I'm saying that the hospitals there
Yes.
would very much, they will have them, and many of them are going to want to promote the services that they have.
I would think so. Yeah. But you know, we don't have
We
contacts
don't have
with those
enough time for
hospitals.
that, but once
No.
we get, you know, like Christian, once we get some of this Medicaid management stuff together with the Ministry of Health on that database and all that Amina's working on with your colleague, we could start finding those things that are needed and keep going for the next fair or something like that.
Yeah, sure. I mean, this is our first fair, our first annual fair or semi-annual. Okay, so we'll meet next week. Friday is good for you, Wycliffe?
Friday is okay.
Okay, same time next week. And in the meantime, Abdul and you will be working on the budget, and he'll be asking me if there's any questions that you two need answered. And I'll send out the recording in case anybody wants to review it. And this is exciting. Thank you so much, everybody.
Yep.
Yeah,
you.
Wycliffe, thank you so much. You're a great partner. You're on mute.
So
Bye.
bye.
Bye. We'll see you next week.
Have a good
Yes.
weekend.
Bye.
Bye.
Thank you so much.
You are most welcome.
Okay,
Bye.
and Amina, thank you, and Abdul and Bill. Yeah, and Elliot, great. And Christian. Oh, Christian's gone. Okay. Bye-bye.
Bye-bye. Have a good
Okay,
weekend.
bye.
Bye.